By Dr. Philip Chan with the Rhode Island Department of Health. Dr. Chan, thanks for being here.
Thank you so much for having me.
So, Dr. Chan, the CDC recommending less vaccinations now. Can you speak to what was removed from the list and the reasoning behind it?
So, I'm really concerned about these changes. These changes are not based on any new data or new evidence, but really based on some ideologic reasons. What basically happened is the CDC made several of these vaccines that we have been administering for childhood, they made them optional and in shared decision making. And I'm really worried that this is going to affect how we vaccinate kids in the United States. And I'm also worried that it's going to create a lot of confusion for people.
Now, flu no longer is on the list, but we're seeing cases spike significantly right now. What does the state recommend when it comes to the flu vaccine?
We are still recommending that everyone 6 months and older get vaccinated with the flu, and that aligns with all major clinical recommendations in the U.S. I think, as you mentioned, we are seeing kids being sick. We're seeing kids being hospitalized, and in other states, including Massachusetts, we're seeing kids dying from the flu. The flu can be very mild, but it can also be very serious, and vaccination is one of the best ways to prevent flu.
The kids who you are seeing being hospitalized with the flu in Rhode Island, are most of them unvaccinated, or is it a combination of vaccinated and unvaccinated?
For most years, it tends to be a combination, but in general, most people that are hospitalized, kids or older, do tend to be unvaccinated.
Now, states set recommendations for schools that required vaccines. Will Rhode Island be changing requirements to meet the new CDC guidelines, or will everything stay as is?
So the state of Rhode Island will not be changing their immunization schedule. The Rhode Island Department of Health still firmly believes in childhood vaccination, and this aligns with other clinical organizations. And the one that I would point people to would really be the American Academy of Pediatrics. This is an evidence-based, science medical-driven organization. Again, there's nothing that's changed in the last year here in regards to vaccines. They still tend to be safe and effective, especially for kids.
What's the message to parents from the state?
The message to parents is, look, there's a lot of confusion. There's a lot of misinformation out there. We're seeing decisions at the federal level being made not based on science, not based on evidence. There's going to be a lot of confused parents. Please do check in with your doctor, with your pediatrician, to make the best decision for you and for evidence-based medical recommendations.
All right, it's a good time to wash those hands and try and stay healthy. Dr. Chan, thanks for joining us today to talk about all of this. We appreciate it.
Thank you so much for having me.
And if you